So PEPFAR, and it's an acronym, stands for the U.S. President's Emergency Plan for AIDS Relief. And it was started in 2003 under President George W. Bush. It actually began in Rwanda in 2004, so we're now 17 years into our partnership between the U.S. government and the Ministry of Health here in Rwanda. PEPFAR was established to address the HIV pandemic in the early 2000s, and since its inception, it's had great success in finding those HIV positive people, getting them linked to treatment, and having them be successful on that treatment so they reduce their ability to transmit the disease. In addition to those who are HIV positive, we've done a tremendous amount of prevention work, so HIV prevention work. I'm sure you've heard a lot about condom use, safe sex practices, a lot of the education that's important for those youth and at-risk populations to make sure they're keeping themselves safe and healthy. And then more recently, PEPFAR has been investing in a lot of the systems in Rwanda specifically, but in all PEPFAR countries. And when I say systems, I mean data collection systems, laboratory systems, and how we purchase commodities, so the drugs that are used to treat HIV. And one thing that's been very interesting and what we've been very happy to see is that those investments that we've made, especially in lab, have really been leveraged to address the needs of COVID-19. So a lot of the COVID-19 testing and diagnostics, which are done in country, are really built on top of those investments that PEPFAR made to strengthen the laboratory system. It was great to have a goal to strive for. We were working for our 2020 goals of achieving 90-90-90, so 90% of the population knowing their HIV status, 90% of those who are HIV positive linked to care and treatment, and then 90% being virally suppressed, which means they can't transmit. So that was our initial achievement, and Rwanda came very close to that goal. We're now working towards 95-95-95. And then that achievement of an AIDS-free generation, we have to work in parallel. So one is finding those people who don't know their HIV status and ensuring that they get tested and know their status, and if they're positive, linking them to treatment.
How do you do it?
That's a very good question. So now in Rwanda, because I think it's like 98% of the population has been tested.
Yes.
But that doesn't mean that if I was tested 5 years ago, that if I've had risk behavior since then I would need to be retested. So understanding what risk behavior means and when you should be retested. And so for us, what we're trying to do is work with the Ministry of Health and other implementing partners to find those pockets of people or those individuals who may be missed through general services at a health facility, and really trying to get those people linked to care. Men are a really huge gap. Globally, men don't go to the health facility. They think I'll just drink some water, take some Panadol, and I'll be fine. So the first challenge we have is getting them to test. One of actually the success stories that we have in PEPFAR with a partnership from one of the implementing partners here is, I think you know, here at ANC, men and women have to come together to get tested.
Yes.
That is a huge success story. Getting couples to come and get tested together, that is not something that's easy to do, and I think Rwanda is the only country that has that set up. And I'm pretty sure Rwanda is the only country that has that established. Other countries may recommend it, but it is unusual when you see women coming here for their first ANC visit that they're coming alone. Most of them are bringing their partner. And so that is a great success, and that's a great way to get men to come and test at the clinic. So we're trying to think of those other innovative ways to engage men to come and access services, whether that's late hours to come after work, weekends, trying to promote these services where men are, so maybe at football matches. I am confident that Rwanda will be one of the first countries to meet these goals. Rwanda has always worked very hard at being a high achiever and making sure that the people of Rwanda have the services that they need. And I think the US government, especially here in PEPFAR Rwanda, we are very happy to partner with Ministry of Health to help them achieve that goal and try to find the programs and the services that will, help make that possible. We, for a very long time, we were doing mass testing of the population, and we're now trying to get more strategic in where we test so that we are accessing those people who need it most. One example, one innovation that we've recently rolled out is what we call index testing. And it's actually very similar to what people have been very familiar with COVID testing. If you've had a COVID exposure, that is built off of very much what we do in HIV. Is if you've tested positive, we ask for your contacts, your sexual contacts, so that we can then begin to test them and identify cases that way. The US government, through PEPFAR, has invested $1.6 billion in Rwanda. And we, through that partnership, we've been, focusing on care and treatment, prevention. And so we have to now look at what the needs are of the population and program to that. So making sure that care and treatment, those who are in care and treatment still have access to those medications. We're not forgetting them, but then also through these programs, the people living with disabilities or key populations, adolescent girls and young women, OVC, really looking at our data and seeing what it's showing us and who we're missing and adjusting our programs to fill those gaps. So what I will say is Rwanda is a very high performer. Our gaps are actually quite small. And so we're not looking to change our programs drastically. It's really fine-tuning the programs that are already there. And then helping strengthen some of those, the things that we're fine-tuning, building that into the national strategic plan for HIV so that that's addressed nationwide through the Ministry of Health. And so that whether there's a facility that's PEPFAR supported or Global Fund supported, we are addressing the needs of the population.